Hello and welcome to Healthy Seminars. My name is Lauren Brown. I'm the founder of Healthy Seminars, Doctor of Chinese Medicine in Vancouver, British Columbia, Canada. My clinic is AcuBalance Wellness Center. I want to thank the behind the scenes, the tech group, and the support and moderators, Sandra Grassa and Lauren Slownway. Thank you very much. And also a big gratitude and appreciation to Rosen for coming together to share some knowledge. And we're going to talk about some interesting stuff today as well related to COVID and Chinese medicine's approach to post-COVID infection. We'll get to that in a moment. I just want to do some housekeeping. I just want to let you know there's lots of stuff on Healthy Seminars for you guys. And if you click on the resources, anytime you get to the site, if you go to resources, that's kind of the hub of what's happening. And so if you look at this calendar, like for April 2021, like look what's happening. Like it is great, awesome stuff. And so today, here we are. We have Dr. Shen-Hammer, which is, I know Ross has studied greatly with Shen-Hammer, so it's nice that you guys are back to back today, Ross. And we're doing a playback with Shen-Hammer on treating infertility with Chinese medicine. It's brilliant. The handouts are amazing, and it's worth to hear again from Dr. Shen-Hammer. And then Ross this weekend on Saturday is doing a 3-hour approved for CEU talk related to diagnosing, treating postural orthostatic tachycardia related to post-COVID-19 infection. And correction, today's topic is not on COVID. It's the importance of narratives in diagnosis and treatment, storytelling, and the patient-practitioner relationship from the Shen-Hammer system, I believe. And then you can just see there's so much happening on here. So if you go to the calendar, this is where you can dial in. Usually the weekends are CEU approved courses. And during the week is our Community Unity Immunity Lecture Series. So this resource page, the Community Unity Immunity, started back in March of 2020 when we went into physical isolation. And it was a way for us to come together as a community to learn and share. So physical distancing, but we are socially not. We are here together, which is why I encourage you to have your cameras on. If it's appropriate, have your cameras on. It's so nice to see other people other than your immediate family. So do have your cameras on. And we appreciate it for these community lectures. They are free for the live webinar. And if you miss the live webinar, you can subscribe to the community library and watch the recordings there. And that's where we have now over 190 as of this recording from the past 10 years recordings on there in the community library. So if you missed any of the previous ones or the ones to come, that's where you can find them. The other thing I want to let you know is other stuff that's happening. So as we mentioned, we have this talk happening now with Rosen. Please post your questions in the chat. And we have a few minutes at the end of this talk for Ross to take your questions. On Monday, we have the end the long hauler's dilemma with classical formula. So Sally Rappaport is going to talk about a Chinese herbal approach to those who are still suffering post-COVID infection. Yvonne Farrell's mentorship program, early bird rate, ends April 25th. So you can come to the resource page, scroll down, and click on this link to find out what she is doing. It's excellent work she's got going on. And then we have the Integrated Fertility Symposium. It is on sale. And it's an early bird rate until April 25th. And I just want to let you know how you find these things on our site. And then we're going to get ready to pass it on to Ross. When you're logged into Healthy Seminars and you click on my account, on the left, you have a menu. You have your courses in here. You will see, go to Community Library, go to Mentorship, go to IFS 2021. So if you're looking for a lecture or you want to watch this again, then you go into the Community Library and you subscribe and you have access to all the community live webinars. So they're free to watch during the live, and then the recordings you subscribe to the library to continue watching. The IFS 2021, you can get it from this menu or from the homepage. There's a menu there. And I just want to let you know that we've created something special for you. It's running all of May and June of 2021. So lots of time for interaction. We've got forums for us to communicate with. We have up to 36 hours of continuing education that you can learn from if you're an acupuncturist, and up to 30 hours if you're a naturopathic physician. And so check out who the lectures are, the speakers are. And we've had our speakers this year create public educational videos for you, meaning that you get to watch the professional talk and you want to share what they just showed you that you can do in your clinic, but maybe you don't know how to articulate it just like them. Well, they've created 10 to 15-minute little videos that you can put on your website and put on your social media, so you can educate and inspire the public to seek you out for that integrated fertility care. So check out the Integrated Fertility Symposium. You can get to it from the Healthy Seminars website. And then I just want to let you know that Ross does have other courses on Healthy Seminar. He has written an incredible textbook called Heart Shock. I should have brought it out. I have a copy of it sitting there, a nice signed copy. Thank you, Ross, for that signed copy. There it is. He's holding it up. You can see a lot of work went into that when you see just the thickness of it. And he has a course on Healthy Seminars that is a nice companion to that book called Heart Shock, Diagnosing and Treating with Shen-Hammer and Classical Chinese Medicine. And then this is what he's doing on the weekend as a live webinar, and then is available online after that, Diagnosing, Treating Postural Orthostatic Tachycardia Syndrome. So I just wanted to let you know about all the fun things that we have going on at Healthy Seminars. Again, go to the resource section. This is where you'll find out. And tomorrow we got the Shen-Hammer replay, so do come to that and just see what's happening throughout the month. Lots of stuff happening. Now, just to remind you, this is for educational purposes only. This is not intended for medical advice, so it should not be perceived as medical advice. This is for educational purposes only. If you have a health condition, please seek out a healthcare provider. All right, Ross is an international speaker. He is an author, and he's an excellent practitioner. He studied with Shen-Hammer for ages, and I am with great gratitude, excited to have him offer this lecture on storytelling and this relationship patient-practitioner, which we know impacts the outcome of our patients. Research is on this stuff. So I'm really curious to see what you got to say about this, Ross. Without further ado, take it away.
All right. So thank you all, number one, for joining in. It's such a nice, it's nice to see so many people come in for this. It's sort of a different type of topic to discuss here today, because what does it mean to create a narrative for someone, and why is it really so important in the diagnosis and treatment process? So basically what I want to do is look at some of these foundational principles. I was talking with Dr. Hammer the other day, and I was mentioning to him that I was going to do this talk, and I wanted to share some of his really guiding principles that he has detailed in his text, The Patient-Practitioner Relationship, because I find that it links in so well with what we do as Chinese medicine practitioners in many respects. So what I want to do is kind of go through some of those key principles, as well as tying in, really in particular, the diagnostics that we apply as practitioners, including the pulse, as well as other things, because framing the narrative around what we are delineating from our diagnostic process to the patient's experience really helps them understand and take part in the whole treatment process. And very importantly, I want to spend time making connections to this longstanding practice of Juyo, or incantatory medicine. And I imagine that a lot of people don't know what that is, despite it being one of the foundational aspects that was included within even the Neijing Su Wen. And so it has an historical antecedent from the beginning of Chinese medicine, but it's been something that's been lost from the tradition. So what does it mean to create a story? The story itself is something that we have to tie in specifically to the patient's history that we're learning from them. So what we do as we're going through our process is we're asking questions, right? Before we get into other significant diagnostics like pulse or tongue or so forth. So we want to make sure that we're listening to the patient, we're understanding all the disparate pieces that make up this particular picture. As we're tying it into the patient's history, what we have to make sure that we're understanding is that we want to understand all the discussions of the circumstances surrounding the onset of the patient's symptoms, right? We want to make relevant all the past medical history, the family history, any histories of trauma and so forth, right? Because the way I look at this is what we're doing is we're trying to understand this discussion as a way to unlock and unwind what this patient is kind of holding in their heart since the emanation of whatever signs and symptoms that they have been suffering from, right? So it's an expression that they are allowed to now bring out into the open. And this may be for many people the first time they are actually sharing this, right? Openly revealing their particular struggle, right? It helps us to kind of disempower and deconstruct all the different thoughts and narratives that they have created surrounding their illness, right? All the things that they perceive that prevent the healing process from taking place, right? And it's very important that we also tie this into the patient's experiences as well as their beliefs, right? And I want to just, one of the things that's significant here is that I just had a patient come in last week, actually, and she's a patient who comes from about 5 hours away, and I saw her a couple of years ago just for an evaluation, pulse evaluation, and to go through her history and then to create an herbal formula for me. And I saw her again. This is about 2 years since I've seen her, and she's been doing wonderfully, and she had some new things pop up, so she wanted to come down to see me. And I was kind of asking her, like, you have lots of practitioners that you see. Why are you coming down here? And one of the things that she said to me, which I thought was really timely for this talk, was that she mentioned to me that she had been treating with a very well-known practitioner up in her area for about 3+ months. And it took her that amount of time to understand some of the dynamics of what was taking place that she said I described to her within the first visit of feeling her pulse, by kind of structuring the narrative and tying in signs and symptoms to the pulse qualities and so forth. Now, what's significant here, again, tying back to my book in Heart Shock, is that this patient was someone specifically with a very robust history of trauma. And because of that history of trauma, she actually had a very poor ability to create her own narrative and explain some of the dynamics that she was experiencing. So using the pulse, we were able to kind of open up a particular dialogue and reveal certain things that would have taken her months and months to share due to the level of intimacy that requires, right? So, and we have to understand, too, the distinction between creating a narrative and this concept that of MSU, right, or making stuff up. We're not making stuff up. We're not just creating and pulling a story, out of the air. We need to be very clear that we're tying a story in specifically to the diagnostic parameters of what we're discovering during our evaluation, right? And so one of the most important things that has to reveal is it has to reveal resonance, right? This concept of ganying, right? Without resonance, right? You can explain and make up this elaborate story, and then the patient kind of sits there and is like, "Yeah, no, that doesn't really resonate with me." So you're not going to get very far, right? So it's very important that as you describe and explain this, that the patient is sitting there, kind of nodding their head, understanding the tie-in to things. I carry this. On my desk, I always have a full box of tissues, and the reason I do that is because almost invariably by the end of me explaining the pulse after the end of the first visit, how I spend about 15 minutes tying everything together for someone, almost invariably someone's pulling that tissue out and wiping away tears, blowing their nose, very thankful that someone kind of like understands what they've been going through. And I'm going to show you, at the end, I have a very small case study that I want to tie in because this is something that happens again. And one of the really interesting things about that is I know, based off of the creation of this narrative, and when it creates that resonance to the patient, whether they cry or nodding their head or express verbally that this makes sense and it resonates them, I know from that point on that they're going to do very well with treatment, right? I know they're going to respond to my treatment no matter what it is, right? And of course, it's going to be something that's tailored to the diagnoses, but there's so many different ways that can go. But the important thing is the creation of the resonance, right? And so this was something that we see in terms of tying in the beliefs. I want to just bring up some historical antecedents way back into the first Taoist movement, the Tianshi Tao, or the 5 pecks of rice movement. So this was something, where the first Taoist movement was the creation sort of a theocracy out in Sichuan. And one of the things that happened here, this was a very medically oriented movement as well. The priest would meet with a particular patient and they would go through this kind of narrative process In this scenario, it was a guiding process where the patient would explain or be asked to explain how their history, their actions, beliefs, and so forth was kind of enmeshed karmically into the creation of whatever signs and symptoms of illness that they were experiencing. They would go into this kind of meditation chamber, and then they would kind of figure out their role and in the experience of their suffering, and they would write out a sort of confession of sorts. And then that would be done in triplicate, and it would be submitted to particular anthropomorphic deities, whether it be burned or buried or in the water and so forth. And this was a very significant process because it ties in the importance of the patient's responsibility into the process, right? And it doesn't mean we're blaming a patient for their illness. That's nothing to do with what we're describing, but we have to understand the relationship between a narrative, a perception of illness, and how that resonates to the person's experience of ongoing suffering, right? And so we tie in the importance of precepts, the importance of ethics, the importance of morality within this. And we're going to see this very clearly in the historical use of Juyo medicine, which we're going to get to in a little bit. But also, a very important phenomena that takes place is the creation of intimacy, right? What I mentioned with this patient who drives 5 hours to come see me, when we can describe something that's taking place on their pulse, and not to say, well, not rely on a person to tell me whether or not they're depressed or fearful or anxious, but I can feel a pulse quality and then ask questions pointedly, trying to draw out some of this information from a patient. It becomes very significant in creating an intimate interaction, which allows for trust and respect and confidence in the treatment and the practitioner to develop from day one, right? And we know that we do this all the time with whatever model of Chinese medicine that we practice, right? If we even just think about some of the difference between a 5-element practitioner, a TCM practitioner, think about a classical practitioner, when we overlay for even the sinew channels and the divergent channels and the low vessels, if we look through any of those lenses, what we find is we can create a slightly different story and narrative based off of how that particular energetic channel system defines and sees the disease process, right? They all have different personalities and so forth. And so it's not so different from applying some of these things, right? So it's important that we understand which narrative and story and lens that we are applying, but we also have to understand the narrative and worldview that the patient is using to understand their own experience of suffering in the world, right? And how do we get, one of the things that Dr. Hammer says is, how do we get people to share what's in their deepest of hearts, right? And we're going to talk about some of his specific principles in that regard. So what I want to show first is just, so this chart comes out of chapter 15 of the handbook that Dr. Hammer and a lot of us as certified teachers have played a role in editing and creating. This particular chart demonstrates some of the pulse qualities that we can feel in the Shen-Hammer lineage and what some of those psychological conditions that they point to, right? And so the one I have circled on the left is that rough vibration, which of course I have that set aside because that's the kind of the pathognomonic finding that helps us to understand that the person has experienced a sort of some type of trauma, but not just any trauma, but a trauma that rises to the level where it would create what we call heart shock, right? Which becomes then this kind of systemic instability, right? It's not just, a broken arm or whatever it is, or a twisted knee or elbow or so forth. This is like something that becomes a systemic block to the healing process and creates a whole sequela of things in the nervous system, in the heart, the circulation, blocks the portals and alters perceptions and so forth. So that I want to just point to a few of these because I think that they're instructive in understanding a little bit about what we're doing with the creation of a story. So, for example, if I'm feeling a person's left distal position and I find a very muffled pulse quality, it gives me an opening to ask this particular patient about whether or not they're experiencing depression. And we can get it. And of course, I have this number 13 listed here. And because there's actually 13 different types of depression that we delineate in the Shen-Hammer model, and the same for anxiety. So we can get into a very specific conversation about the lack of joy type of depression that they're experiencing, where that stems from, right? What's going on, how they're viewing their life, what are their discontents, what are their desires that aren't being met. So this starts to open up this whole process of investigation into how this person is experiencing their own suffering, right? We may see a flat pulse in the left distal position, which is showing up down here on the bottom of the page, right? This shows up with someone who's experiencing kind of jealousy and vengeance, and tends to be a pulse quality that we see with people who've had traumas at certain parts of their lives when they were physically in a weakened state. Or it may suggest even that this person had the cord wrapped around their neck at birth. And so we can investigate into this. And if that bears out and it bears fruit, we can understand the entire sequela of signs and symptoms that develop from that initiating traumatic event of having the cord wrapped around the neck. We know where that goes, right? I mean, I detail this significantly in my textbook, right? So this, again, something that the patient would have no idea about in terms of how that particular event has led them to now becoming depressed and jealous and anxious with explosive rage, where they feel like they can't control themselves, and they feeling a certain degree of anxiety about when they're going to lose their temper and what that's going to do, and all the things that go along with being in social context and how to control themselves and so forth. So we can, delve into this in a much more proficient way by understanding the tie-in and the narrative that these things create. Again, also, so a diaphragm pulse. This is one of the most common things that we see. And this here is when someone is kind of suppressing some type of emotion that they're unwilling to express. And this may be because, we need to understand what it be, but it may be because of divorce, right? It's very commonly seen where someone has to replace these sort of tender feelings with this anger that has no outlet for expression, right? And this can create things like explosive anger and impotent rage and so on and so forth. And we have to understand how to kind of unwind some of these, right? And navigate this terrain with a patient from a psychosocial perspective so that we can understand the complexity and the entirety of what they're experiencing in their day. Because if someone's is constantly trying to suppress something, and all you're trying to do is trying to like smooth out liver chi, you're not going to get anywhere, right? This person is because it's not this is not a repression, right? This is a suppression. They're consciously doing it. They have to understand that they need to kind of engage. They need to be engaged in the process of releasing this. You can't force this on somebody, right? So again, we can look at this in all these different types of pulse qualities. And I'm just giving some of these psychological pulse qualities because I think they're some of the easiest ones to understand in the narrative creation. And they're also, there is sort of a little bit of stigma still around a lot of these emotional conditions. So it's some of the things that patients are reluctant to share. And they also may not even be aware of some of these things at the same time, okay? So some of these foundational principles of the patient-practitioner relationship I want to just run through quickly. So the first is that people come to you because they want to get back to their lifestyles without paying the consequences, right? And our job is to guide them to seeing their lifestyles are contributing, right? So we want to connect the dots for patients. We need them to understand how their lives and their habits are part and parcel of their suffering, right? Without that, we kind of play this role of, sports medicine, and not to say that all sports medicine is this, but we're not trying to just patch someone's knee up so they can get back on the field so they can injure it again and then come back and rely on us all the time. We're trying to create a narrative that allows for an ongoing healing process, right? And so one of the things I wanted to show quickly is, I look at Chinese medicine sort of like, there is like a million different data points, right? We have all, in every one of these colors and dots are a reflection of a sign, a symptom, and so forth. And so, of course, this becomes like this huge mishmash that we can easily get lost in, right? We can start focusing on one of these colors or dots, and with the exclusion of all the others, or trying to focus on a few and not understand the forest for the trees. But what the narrative process does through the pulse and the detailing of this diagnostic process is it allows us to start making connections that might not otherwise be obvious. And so as we start doing this, we start to create a story for our patient, and we start to see the borders, the shadings of a picture starting to develop. As that moves on, we kind of continue layering in detail upon detail until we get to the final story, right? Which looks like this beautiful masterpiece that everyone can kind of resonate with, right? Now, what happens when the patient kind of, doesn't truly resonate with what you're saying? Then you wind up more with something like this, right? And so we have to kind of go back and then check our story, right? Go back and look at our pulse, look at the tongue, look at the different side of 10 questions, and maybe see how we were maybe missing something or need to interpret something in a different manner, right? But this is what we're shooting for, right? This is the process of starting to pulling the lines together to create that process, right? So this is really our goal, all right? Dr. Hammer also stresses respect as the foundation to the relationship, right? It's the basis of trust, and it sets the stage for the patient's self-esteem. Oftentimes, there's a loss of esteem and self-worth as patients come in. They've been suffering for a long time. Some people will feel guilty about lifestyle choices and the contributing factors and so forth. Which also brings us to the next point of objectivity, which is that we're not imposing any particular judgments, right? This is not a heavy-handed narrative where we're explaining to the patient all the things they're doing wrong and all the things they need to change, right? The purpose here is to create a resonance, as I said, right? The patient should recognize, right, the echo of their lifestyle and their experiences, right, in what you are describing and respond as such. We're using the pulse and other diagnostic tools as an objective guide to mirror this back to our patient, all right? And number 4 here is our job is to bring out and uncover what patients fear is crazy in them and to release them of that fear so they can live freely. I had this one starred because I find, I remember reading this many years ago and thinking wow, this was just so important. And I also remember, so I've known Dr. Hammer since 2001, I believe personally, through studying pulse and being a teacher of the Shen-Hammer pulse system. And I remember seeing him as a patient maybe a couple of years later. And if not in the first 5 minutes, he identified, what that was for me and brought it right out to me and held that mirror up. And it was a profound moment. It was an important recognition that was really, it was an integral part of the treatment process, right? And everyone has it, right? Everyone has this aspect of themselves, right? The other thing is that we have to use our intuition to interpret and respond to the patient, right? And this is always, one of these terms of intuition that can seem a little, non-medical or non-objective, right? But there is a major role of the healer in this, right? So Dr. Hammer says, in a healing system where movement and balance of energy is the critical factor in sickness and health, the energy of the healer enters significantly into the system as a positive or negative force, right? So our intention has a great influence on the quality of the treatment, and we need to be mindful of that at all times, right? We provide the patients with courage, right? We demonstrate to them their strengths. We're not just here to show them all their weaknesses and things that are going wrong. We need to show them all the things that are going right, that they're functioning well despite these things taking place. And we need to highlight those things so they can understand them, right? We give those patients confidence in their healing, right? We tie all the branches together, right? So that they can tie and point back to these root issues and help them understand all those interconnectedness, right? And we must know ourselves to do it, right? Dr. Hammer talks about this as the descent into hell, right? How do we manage patients if we haven't done the work ourselves, right? If we haven't gone there ourselves, right? So there's this big difference between, being objective versus intention and sincerity in the process. However, they're not mutually exclusive, right? We cultivate ourselves and bring the sincerity to the patient so that we can learn to drop our own ego and our own agenda, right? We're not here to initiate our own passions, aggressions, likes, dislikes, judgments, and so forth onto our patient. We're here to be as objective as we can in this process. So listening with the third ear, right? We have to be aware of the subtext, right? There's always subtext. There's always things that the patient does not want to tell us or wants to tell us, but does not have the verbal skills or the capacity to tell us and say it and verbalize, right? We have to be able to hear the different contradictions, right, that the patient is expressing, right? Is there a crying voice in the midst of saying something? Are they laughing nervously while describing particular types of pain? Right? We have to be sensitive to these things. We have to also understand this concept of reframing, right? We always want to tie things back to the energetics. So what Dr. Hammer says is if anger, joy, compassion, fear, and sadness are acceptable analogs of energy transformations, right, which we know they're part of the 5 phase and cardinal cosmology, then why not judgment, planning, will, warmth, precision, pretense, denial, projection, repression, reaction formation, reversal, sublimation, all these things that patients are experiencing and demonstrating. We have to consider the entire range of behavior, all the components of their personality and their intention, right, as a province of energetics. And this becomes really a powerful thing when you start to extrapolate what this really means in the context of an interaction. Because if by definition we're practicing a system that is representing a unified statement of the cosmos, then that can't be applied in a piecemeal fashion, right? We have to understand all of what that acknowledge all of what that means in its totality. So when we think, for example, about the mind, right, guides the chi, right, or where the mind goes, the chi follows. What does that mean if a patient is constantly dealing with profound fear? Where is their energy going? What is that draining? What is it doing? What if a patient is dealing with particular addictions, right? Whether it be drugs, pornography and lasciviousness, whatever things that they are drawn to, their chi is constantly being moved and segregated into those areas and dynamics. We have to understand what that means. And likewise, if we're coming from a system of medicine that recognizes a hun and a po, right, as internal souls, we have to recognize, number one, that those come with the first breath, right, as a postnatal, with a postnatal significance. What does that mean for a prenatal significance? Does that mean we have to then now start to think about all the elements of what internal intelligences mean? If we are living with a microbiome of billions, if not trillions of different bacteria and a virome that is said to even be 10 times more than that, and each of these things have particular intelligences and inclinations, what does that mean in terms of understanding our mind and emotions as a unified aspect of our Shen, right? Do we relate to this idea of Gui, right? Ghosts, right? Internal ghosts and body gods, external ghosts and body gods, goo and pathogens and all these different types of things. This now starts to open up into a whole realm of metaphysics and even, of course, into the religious realm as well, right? So we also have to make sure we're providing feedback for the patient. And this is such a crucial aspect of what we do, because we have to do this, of course, with humility, right? We're not putting ourselves first. We're putting the patient's needs ahead of our own. We're not telling them they're doing something wrong because we do it right and we want to feel good about ourselves. We're doing it so that they can understand the relationships of things, right? We want to validate their experience in the world, right? And this is key, right? We want to clarify what we think we're hearing. We want to repeat these things back to our patient, question the things that we're not understanding or information that we feel we need to know along this process, right? And we need to make sure we reframe it and provide insight and perspectives from the Chinese medical paradigm so that they can understand the ramifications of their actions, right? We need to make sure we give proper attention to these things, right? People have to feel heard and seen, right? Providing hope and acceptance. We have to be present. We have to hear their story, right? If we're not hearing their story, they're never going to feel like that we're going to understand who they are and what they're experiencing, right? I just had a patient come in the other day with a 2-year-old child who was dealing with a whole sequela of hypotonia and neuropsychological component, developmental delays, and so forth. And I was asking all these particular questions and delving into history. And, she was just shaking her head and shaking her head. It took her, so she's been going to doctors for a year and a half now for concerns about this patient. Every doctor she's telling these stories to, they kind of poo-poo and they say, oh, it's not related to this. It's not related to that trauma. It's not related to this particular thing, and so forth. And I started validating and explaining all the different connections between those things. And it was a real kind of aha moment that not only provided certain degree of trust in moving forward with treatment, but also validated herself, her own knowledge of what she has seen and witnessed in her own child, which is very, very powerful, right? So the last one that I want to mention is, as health practitioners, we have to value. We only have value to the people who consult us if we offer them something different from what the usual response is, right? So people come in and in all sorts of pain. They come in acting out, and if we respond to them in the way that they're typically responded to, we can stunt the relationship and the therapeutic process from in a very quick way. So we need to give them the beginnings of a new experience, right? And that also helps to dilute a lot of their suffering, and so forth. So I know we only have about 20 minutes left, so I want to move into this Juyo, because this is really important. So Juyo incantatory medicine is really like, in my mind, it ties in all of what we're just talking about. So Juyo employed prayer and incantation, talismans and gestures and medications, right, into this kind of nuanced clinical encounter, which was meant to reveal the hidden root of a disorder. And that could be anything from blockage of qi to like spirit possession, right, gui, emotional imbalances, or loss of virtue, right, meaning that inclination towards things that someone, and habits that would be opposite to the healing space, right? So it was a place where the priest or the doctor would engage in this kind of therapeutic play. It was a ritual, right? Going back and forth in this narrative process where we would be engaging the patient in a whole host of questions, trying to draw out from the patient their experience of their illness, right? And so different types of rituals, symbols, and so forth were there. And the goal was to find and manipulate this imperceptible cause of illness. Because one of the things that Juyo was used for, if you could feel someone's pulse right away and say, oh, it's from this, or you can, speak to them and get, through the 10 questions and figure out, oh, this is a wind cold invasion, and you give your ma huang tang and they get better. That we didn't need Juyo necessarily for something like this. This is where the causes were so imperceptible and so subtle that we had to delve deeper into the patient's lived experience, right? So this was looking specifically at getting the patient to name and participate in the affliction and the decision of what this diagnosis was. And at that point, we can see the efficacious nature of what Juyo offered, right? And if we understand that speech is the sound of the heart and that writing is this sort of graphical expression of the heart, we can understand that the written form of these talismans and these symbols would have this kind of significance that would unlock the patient's illness, right? So the ritual of this narrative process in this play gave the diagnosis its meaning, and it defined the relationship specifically between the patient and the healer, right? So because the power to heal has to come from within. And if the patient is constantly hiding some type of vice or whatever it is, it's going to be very hard to allow for the healing process to take place, right? So in this kind of reinterpretation of Juyo, the power to heal lay within the patient's hands, right? So we reinterpreted kind of this idea of ritual prayer, right? Because part of what we're doing is creating, this is what was incantatory medicine. There are particular prayers that go along with the unlocking of the illness with the written form of the talisman, right? And so this would all tie in and relate. But what's important here, I want to just read a very quick slide, which was from Zhang Jiebin, of course, we know as one of our ancestors in Chinese medicine. So according to him, the root cause of disease lay in the person's immoral proclivities and the long harboring of vices such as lust or greed that would manifest in this emotional or physical disorder, right? And this is why the term that we see in the Neijing was that these disorders were as if they were caused by ghosts, right? And so there was, and this morphed over time historically, whether or not this was believed to be caused by ghosts or just as if were caused by ghosts, because the causes were so imperceptible and subtle because they were harbored internally by these patients in terms of their emotional states, right? But what we were looking at here was understanding that what overcomes the illness was an understanding of where the illness arises, right? And being able to expel and stop that meant understanding and seeking out the root cause of that from the person's heart, right? And so we know the 7 emotions, right, bear people's likes and dislikes, right? And so if someone's likes and dislikes are inclined, then their chi is going to be inclined in that particular way, right? Where the mind goes, the chi follows, right? And so pathogens at this point have a capacity to take hold, giving rise to what he called ghosts in the heart, right? So those who habitually feel malice, behold malice. Those who habitually feel envy, behold envy, and so on and so forth, right? And we can see that those whose hearts harbor overwhelming sorrow, right, depressing ghosts attract them. And those who harbor wantonness, manic ghosts attract them, and so forth. And so to him, this was really a reflection of understanding where the disorder arises from. And so he said, once you know the root cause of the disorder, then and only then would you have a method for curing that, right? So this is, a key component in what we're trying to establish with our narrative and storytelling capacity, weaving in all the disparate data points and details of our diagnoses, right? At that point, he said, Juyo was always effective, right? And this is not a new concept, right? So this has been practiced by Chinese medicine practitioners from Zhang Jubin to Sun Sima to Ye Tianshi to Li Shizhen, Ge Hong, Wu Zhutong, and so forth. It's detailed in discussions of the Neijing, where Qibo and the Yellow Emperor discuss that these aspects of curing illness where their causes were so minute and subtle that they could not be detected by the senses, right? And so it was said to heal the body and spirit, but also protect them from attacks of deviant qi, right? Xie, right? And demons, aggressions from other people, and so forth. It was for acute, but also chronic ailments, things that had unclear causes as well as malevolent forces, right? So there was no possible treatment for any disease if the doctor didn't first address the desires, correct the thoughts, eliminate the vices, and appease those fears, right? And you can see Wu Zhutong's quote below, that for inner ailments, Juyo must be used first. And this means explaining in detail the cause and conditions so the patient understands them and dares not make the same mistake again, right? So this is exactly what we're looking to do in the creation of our narrative. Now, I don't know if we have time to get into this, but I wanted to hit this last slide because this is so important. When we're talking about a talisman, this goes back into a lot of historical aspects in terms of Chinese history, where talismans or talis, which is what talismans are based on, were these kind of passports that were used as certificates of legitimation. So if someone wanted an audience to go into the imperial court, they would have to show their half of a talisman that matched the other side, that would legitimate who they were and that they had the right to be there. When they left to go off, they would get talismans that when they returned, it would match back up. They were tallies that were used in terms of all different types of interactions, whether it be sales and creditors and so on and so forth. It was used very commonly in military operations. In Taoism, talismans are used specifically as a healing mechanism, where we're drawing out very ornate graphical representations through what we call cloud script, which is a language that is meant to kind of move the gods and the spirits and communicate with them, which has very particular information on there in terms of who we're asking and very specific things. But as we're writing that talisman out, the idea is that it's being matched and mirrored by the deities. And once they see that they match perfectly, then they legitimate you as the person asking for the particular thing that you're asking for. And then they impart, once you say the proper incantation, then they impart the particular healing mechanism involved. What I want to point out to you is that what this really is something that we do all the time in a less religious component, where the pulse record itself, all the diagnostic information and criteria that you are writing down in your notes, serves specifically as a talisman. They are the symbolic, energetic, sensational descriptions of what we are feeling emanating from the patient's body. It's the other half of the tally that is existing specifically and emanating from the patient. So when I feel a person's pulse and I feel a rough vibration, and I write that down in my notes, and I explain now the narrative of what that rough vibration means in all of its glory and all of its permutations, and how it's impacted all of the sequela of their signs and symptoms. And that becomes the incantation, by the way, the narrative, the story, and it resonates to them. It automatically unlocks the healing potential of whatever therapeutic intervention we're going to be, whether it's acupuncture, herbal medicine, essential oils, massage. It doesn't even matter at that point, right? So the importance of the sincerity, the skillfulness in being able to do that in a way that is devoid of ego, right? And is a way of kind of almost separating out. When we do pulse, we kind of go into sort of this almost like we're doing qigong, right? We kind of empty things out a little bit. We just perceive as objectively as we can. We recognize those qualities, we jot them down, and then from there we kind of narrate it back and give them meaning and guide our patient and explain, again, what Dr. Hammer's talking about, explain to them exactly, releasing them from their fears, right, of what they've been experiencing, tying it into their history, tying it into their habits so they understand their own responsibility within the suffering that they are experiencing, right? So the pulse qualities and the sensations are the closest thing we have to the manifestation of the patient's energetics, and it mirrors their lived energetic reality, right? So this, right off the bat, brings trust, respect, intimacy into the clinical encounter, and is the first foray, and really is the first part of initiating the healing mechanisms, right? And then lastly, this very quick, I know I'm going really fast because an hour is just not enough time. But this patient example, which is a very quick one, I saw a male, 14 years of age, who's been suffering from anxiety, panic, and debilitating migraine headaches for 2 years. He's been missing school every week. He's a significant athlete. I mean, he's a very high level, travels all over the place, very competitive. And he had all these horrible experiences in the past with acupuncture, which was very painful, and he was afraid, he didn't want to come in. But we tied all this stuff back to a trauma that he had while he was on vacation, where he had a very significant head injury, nervous system tension, and ears ringing, volume of the sounds. And he wasn't with his family, he was with friends. He was in the water on like a boat and smacked into someone, and he got started losing consciousness. He was picked up by helicopter, taken to 2 different hospitals. He had to be physically restrained. He was fighting. It was a whole very significant thing. And I took his pulse. I explained to him this whole dimension of the pulse, the narrative, the complexion that he had, the blue color, all this into this diagnosis of heart shock and all these other disparate things. And you can see that I'm listing here in terms of separation of yin and yang in the liver, and Xiao-Yang, sinew meridian issues, and triple burner dynamics, and so forth. And at the end of that, he was just kind of like sitting there, and he seemed a little kind of stupefied. So his mother was sitting next to him, and I asked him if everything was okay and how he felt. And he's like, he got a little teary, and he said, like, I've been trying to explain what I experienced to my mother for 2 years. And it's just, she tries to understand, the doctors try to understand, but they just don't get it. They don't understand. And this is the first time that someone has actually mirrored back to me exactly my experience. And right at that point, I knew he was going to do well. After the first treatment, he felt amazing. That night, he had a bad anxiety attack with a headache. And then I saw him the next day, and I explained to him that this was the first time that he had talked about his trauma in 2 years. And he really kind of went through in detail So I kind of explained to him that this was kind of a releasing of this. And then next treatment felt great. I went away on vacation for a week, so I hadn't seen him in 10 days. He was still doing great. And he's been doing amazing since then. With I did one treatment on him, and he had a little bruise on a point. And I knew that he was getting anxious. And I said, okay, I was trying to reassure him, like, this is common. This happens all the time. Not a big deal. And he had like a little minor headache that night. And so, which was to be expected, which I had prepared his mother for that already. But I knew that was going to be part of it because of the psychological component of what this was doing. But anyway, I just wanted to go through that because I think it really doesn't even matter. I don't need to go into what my diagnoses are in detail or what the treatments were in detail because it's really almost irrelevant at that point. Whatever I would have done for him, he would have had the confidence to heal. Does anyone have? I know we have 10 minutes, so I tried to stop in time, but
we got some questions for you. So I just want to let people know again more about treatment style. Ross has a course on demand called Heart Shock: Diagnosing, Treating Shen-Hammer in Classical Chinese Medicine. And then if you go to our upcoming live webinars, my first question, I know we see some other here, is we have Ross doing this 3-hour lecture. It's available for a live webinar and then the recording immediately after. Why did you choose this topic? I'm just wondering, like, what drew you to do a talk on this orthostatic, like tachycardia, the rapid heartbeat with COVID? I'm just curious. Are you seeing it in your clinic, and what should we expect from this lecture? Because it's a very specific topic.
It is, yeah. So, well, it's a near and dear topic to me because it's something I've been diagnosing POTS for probably a decade now. And I've been seeing it with increased numbers over the years. And then all of a sudden COVID hit and it's like exploding even more, And so, I think you probably remember, we've talked about this diagnosis in the past, a couple of years ago. And, we were thinking about putting a class together back then. And it just seems so much more timely right now that I think it's one of those things where maybe not everyone was probably seeing a variety of POTS patients in their clinic, but I think probably now, if anyone's treating people post-COVID, chances are, if you haven't already, you will start seeing this dynamic take place with your patients. And I think some of my experience with Shen-Hammer and the pulse really allows for a specific signature to show up on the pulse with what we see and diagnose and how to treat it. So I think because of the ubiquitous nature of what we're seeing, I thought it was a very timely thing to discuss. And I also think, and this goes why I also chose the topic for today was because I think the narrative component of everything we do becomes so important. And I think it's almost more important when people are coming in with these kind of unknown illnesses, right? POTS is something that most people have not heard of before. And it's a very destabilizing, troubling thing. And I think if we have a way of explaining narrative to tie all these things back to root causes, we can give patients the confidence to undergo treatment and see the efficacy of what we can offer in that regard.
All right. So thank you for that. And just so you know, if you're looking for the recordings to this and other lectures, you can get a membership to the community library. And that's where this lecture is. So if you want to watch it again, plus all the other ones, you can find them on the community lecture. And what are we at? I think we're at 190 or something as of this recording, 191, and then this will be 192.
Ross, we have a specific question, if you don't mind just addressing this one. What if an adult who does not have a capacity of verbalizing themselves, for example, a lack of vocabulary or language difficulties, any good tips for helping them?
Yeah, well, so that is partly what I was describing in that first patient who was a trauma victim who didn't really have the capacity to verbalize a lot of what she experiences and suffers from. And so here, you don't really need the patient to verbalize that much because what you're doing is you're creating the narrative for them. You're taking the burden off of them to help categorize all the different things that you are seeing through your diagnostic process and through the pulse, the tongue, and so forth. So I'm assuming that they have some capacity, or someone would be able to be describing some of their main complaints and some of their history. That would be helpful. But even without that, it's not necessary, in that regard. They should be able to at least create some type of understanding and resonance from what you are describing to them based on what you're feeding back to them from the pulse, the tongue, and all the other diagnostic criteria.
Ross, I want to thank you very much for putting this together. This is the time where in our community lectures, we open up the mics so you guys can unmute yourselves in a second, and we send our gratitude, our appreciation, our love, which send your incantation to Ross now for his love and healing and continued success. Thanks for doing this. Appreciate it. And thank you guys for joining in.
Thank you. I hope it was helpful. I know it was a little bit of a race to get through that material, but
My pleasure. You guys can unmute yourselves if you want to send him an incantation or a thank you or hello to each other.
Thank you.
Thank you.
Thank you, Ross.
Yeah.
Thanks, Ross. This was fantastic.
Thanks. It's great seeing so many faces I recognize too. I appreciate the nice response just showing up today. I know it's like the random middle of the day.
I agree with you. It's nice. I think we had about 100 on. Over 200 had wanted to join, but it's just nice that 100 people come to hear something about this, such an important part of our medicine. And we get so focused on physical fix. And It's so nice that you brought this back. Before you go, I'm just thinking of a Shen-Hammer quote, like literally what he said to me. I've read it before, but I was a younger practitioner at the time, and I was complaining about my difficult patient. And he said, Lauren, your patients come to you not to be difficult. They come to you for help because they are difficult, right? Meaning that that's your job to hear them, understand them, and it's part of what's going on with them, why they're so difficult. So they're not. And I thought that was the last time I ever complained about a difficult patient, because I had a whole new perspective and perception of the people coming to my treatment room, that they're coming to me because they're difficult.
Right. And help me. Totally. And that was the number 13 of my slide, which is you have to offer them something significantly different than what that typical response is. Because usually when a difficult person is in front of you, you don't typically welcome them in and take that all on and give them, love and affection and other things that are so important in that clinical encounter.
Yeah, I used to refer those people to a clinic down the road that I didn't like so much, but now I take them on and I work with them.
That's great.
Hey, it's so good to see everybody's faces. Thanks for your cameras on. Thanks for coming out for another community lecture. Again, with a subscription to the community library, we kept the fee low, so it should not interfere with you wanting to do it. It's like a cup of coffee, one coffee a month you give up, and that's your subscription. So we made it that the fee would not prevent you from wanting to do it, and we're adding to it all the time. You can sit there and watch as many as you want, as often as you like. Ross has, as I mentioned, his on-demand course on heart shock, and then his live webinar that's happening this weekend. And when you register for a live webinar, you automatically get the recording. So if you want to register for it, you have 2 years to complete it for CEUs from the date of the live stream. Even if you don't make it, you still get the recording. If you need live CEUs, my California friends, you do need to be there for the webinar to get your live CEUs. I know you have patients. So Ross, we'll see you on the weekend, and looking forward to your upcoming lecture on the weekend. Thank you guys for joining us. If you do reproductive health, check out the Integrated Fertility Symposium. We put something special together, and it's not like a digital conference you've ever experienced before. First time we're doing something that we're doing. It's very different. So come and be surprised. And I think it's going to be well received. I sure hope so. Take care, everybody.
Thank you. Bye-bye, guys.